Thank you so much for coming out today. We're going to talk a little bit about Medicare and the changes to Medicare. It's an exciting subject. I'm sure you're all thrilled and on the edge of your seats, right? My name's Rory Baker. I am a retirement specialist with Bankers Life here in Traverse City. And one of the areas of retirement, of course, is our healthcare. And so it's an important part of what we do in retirement. And so I wanted to spend some time today going over what Medicare is. There tends to be a lot of confusion around Medicare. And so I'll spend just a few minutes talking about the system, how Medicare works and what it means to you. And then we're going to open it up for questions. I'm sure there are a lot of them. So one of the things that we find interesting about Medicare is how little people actually understand what it is, what it covers, and what your rights and your entitlements are. This study was done by United Healthcare, and some of these numbers that we're seeing on the screen are pretty staggering. It's interesting that on the top graph, that 59% people say that they have a good understanding or an excellent understanding, but then when we start breaking it down between A, B, C, and D, we start to see that not nearly 59% truly have a good idea of what Medicare is and what the different parts are. As baby boomers are transitioning into Medicare, 56% of them don't even know where to begin. And so we'll go over that a little bit today as well. For those that have group healthcare or care from the Affordable the Care Act, notice that 76% of them have struggles with it, and that 1/3 of people believe that Medicare is done on the healthcare exchange. And so just a few misnomers there that we're gonna talk about a little bit. So let's talk about the four parts of Medicare: Part A, B, C, and D. So original Medicare, whenever you turn 65, or if you have a disability before the age of 65, you become eligible for Medicare. And Part A, this covers your hospital costs, right? We say that there's no premium for it. We say that it's free, but in reality, this is what your FICA taxes have been paying for all these years. And so even though there's not a fee for it, it does cover your inpatient stays as well as skilled nursing. Then we have Part B, and this covers your hospital costs. This also covers labs, x-rays, technicians. There is a premium for Part B when you become 65. It comes right out of your Social Security check. And this year, it's $170.10. And going into 2023, that cost for the first time in a very long time is actually going to come down rather than go up. And so it's going to come down to $164.90 for 2023. Then we have Part D, and these are your prescriptions. You sign up for Part A and Part B, and then you also sign up for a Part D. Now, what's important here to understand is that you're signing up for each of these parts. You may be fined if you don't sign up for Part B or a Part D. There's a fine that goes along with that, unless you have creditable coverage, which is something that you would get from your employer or VA benefits or something along those lines. Now there is also a Part C, and this is what you're seeing on TV all the time. Joe Namath is talking to you, telling you to give your zip code and get onto a Medicare Advantage plan. This is Part C. What it does is it wraps Parts A, B, and D into one plan for you. When you're on original Medicare, Part A, B, and D, this is administered by the federal government. The Part C plans are administered by a private insurer. What has happened over time is the federal government has realized, especially with the number of people that are coming onto Medicare, they simply don't have the resources to be able to administer healthcare. And so what they do is they subsidize private insurers in order to handle your Medicare for you. They handle the billing and they administer the care for you. And so it ends up being a win-win for folks because the private insurers tend to be a bit more efficient in the way that they run their programs, and they're able to offer additional benefits like dental, vision, and hearing. You may be familiar with Silver Sneakers, which is a gym membership program, and there are other benefits that come along with it. And so as you're deciding whether you want to do a Medicare supplement or a Medicare Advantage plan, you really have two ways in order to approach that. Let's look a little bit closer here. We had just talked about Part A being $0, that your FICA taxes covered that. Part B, the premium is $170.10 in 2022. But notice there is a deductible there as well. And in 2022, the deductible is $233. That will come down slightly as well in 2023. If you decide to go with a Part D plan to go with your Parts A and B or original Medicare, there is a separate premium for your Part D plan that ranges between $15 to $120. You get to pick which plan you're on, and some of them have deductibles and some of them do not have deductibles. So there's a lot to go through there, and that's where I help a lot of people, is helping them choose their Part D. And because they change every single year, we have to do a review every single year to make sure that the prescriptions you're on are in the drug formulary for the plan that you have. Also with Part D, there's what we call the donut hole. Is anyone familiar with the donut hole or had to deal with the donut hole? A few have, yes. This is where your coverage stops and you have to pay a higher copay during a period of time. This is typically right around the $4,500 range. I'm not going to give you a specific number because it changes every year as well. But once you have put in around $4,500, that's where you enter this coverage gap or the donut hole. And then once you reach a little over 7,000, that coverage kicks back in and it covers 95% of your drugs again. It's a unique little part of it. So if you do have expensive prescriptions, if you get into the donut hole, you just need to know that you're going to be paying a little bit more for your prescription drugs during that time. Part C, there are plans that are $0 premium, and they can go up to around $20 premium. They do have a deductible, and they have what we call a maximum out-of-pocket expense. So if you use a lot of healthcare and you've surpassed your deductible, there's a $5,500 maximum out-of-pocket expense on many of the Part C plans. Some plans are higher than that. This 5,500 is just an average number for you, just so that you're able to look at that. Again, we said that the Part C are private insurers. And again, these plans, because Medicare changes every year, or changes to Medicare, I should say, the Part C plans change along with that. Any questions so far? Yes, ma'am. Mm-hmm. Right. Okay, so gotcha. Okay, so for our online audience, I'm going to repeat your question so that they can hear it. The question was, as we age, what are the strategies in choosing, I'm paraphrasing a little bit here, what are your strategies in choosing between a Medicare supplement and a Medicare Advantage plan, not only from a cost analysis perspective, but also from a coverage perspective? Did I get that correct? Okay, great. So when we think of original Medicare with our Medicare supplement, the easiest way for me to describe it is we have a premium. We know the premium is going to go up every year here in the state of Michigan, but we start out and it's going to be approximately $130 a month for your Medicare supplement, right? And so we have a premium every month, and that's a high premium, but when we see our doctor, we don't have copays and we don't have deductibles, with the exception of the $233 Part B deductible. But your Medicare supplement, you pay your premium, then you're not paying when you use the care. The Medicare Advantage plan is exactly opposite of that. There's no premium, but when you use the care, when you visit your doctor, when you are hospitalized, then there are charges for that care. Many of the plans are Aetna's, Humana's, United's, Priority Health's. All of these different plans are very similar to each other, and there would be a small copay, $5, $10, sometimes $0 to see your primary care physician, $40 to see a specialist. If you're hospitalized, it's $300 a night, approximately. Every plan's a little bit different. $90 if you go to the emergency room. And so you just have to see what strategy works best for you. And there's no right or wrong answer with either of these. It just depends on your health, your budget, and what your long-term strategy is. In terms of coverage, I'll come right to you. In terms of coverage on the Part Cs, they have gotten better and better every single year. In fact, 5 years ago, there would be some Medicare Advantage plans I would have steered you away from. But as they continue to get stronger and stronger, especially with the dental benefits, the hearing, the vision, there's on some of them, they even have a food card that they give you. Some of them give a premium back to your Part B. There's a lot of really nice plans out there. And what we would need to do is just do an analysis on you individually. We would look at your assets, look at your income, look at your expenses, and we would just see what makes the most sense from you based on your health as well. Does that help you? Perfect. Thank you. We had another question. Yes, ma'am.
Add something on Advantage that kind of bothered me was when it tells you what your copay is for on certain things, it'll say $0 to $275.
Okay, so
I mean
that's hard to plan that out, right?
and the other one. Well, I don't know what the deductible or copay is. I think it's $40.
Typically around 40, yeah.
Yeah, so $12. And
Yep.
I have found Medicare, maybe you pay a little more up front, but when you go through your services, they're paid 100%. I've never had something that much. So
Absolutely.
I should change to, because there are some advantages to Part C, getting dental and also to have the drugs.
Absolutely.
What I have found so far is Medicare suits us better because we need a lot of those. And I think you do as you get older, physical therapy, repetitive type.
Right. So for our online audience, I'm going to paraphrase a little bit about what you said, that your choice was to go with the Medicare supplement due to Medigap and a Medicare supplement are synonymous. Yep. Medicare covers 80% of your costs. You're responsible for the other 20%. And that Medigap or that Medicare supplement is what covers that 20%. And so what you were saying is that you prefer the Medicare supplement, even though the premium goes up every year. One, you're able to budget for it. And two, you know that when you receive care, you're not paying a deductible and you're not paying a copay to the doctor, including chiropractic, physical therapy. Yep. Yes.
They charge you so much in Part C each day for the hospital.
Right. It's typically around $300 a day for the first 5 days if you're hospitalized. And so you would after the 5th day, if you're in the hospital that long, which let me address this part of Medicare for you as well while we're at this. Medicare has DRGs or diagnosed related groups, and this is how they keep the cost down. And so every procedure that you have has a prescribed number of days that you're going to be in the hospital. So procedure X equals 1 day, procedure Y equals 3 days, et cetera. And so if the hospital keeps you in for another day, the hospital is not compensated because Medicare only pays what the diagnosed related group price is. Of course, if the hospital can get you out a day early, if they can do that safely, of course, then they're incentivized, right? Because they're still getting their pay. Some people like to say that they're getting you out quicker and sicker. I don't subscribe to that. I think that the hospitals do a great job of keeping people moving through, and they will release you early if you're healthy enough to do so. You shouldn't worry about, am I going to be kicked out of the hospital? That's not what's going on with the DRGs. What they're doing is it's just a way to keep the cost down. Yes, ma'am, you had a question.
Is Medicare supplements purchased through Medicare?
No, ma'am. Medicare supplements, I'm sorry, the question for our online viewers. Yep, the Medicare supplements or the Medigap plans are offered by private insurance companies. and everyone in the world has one. Everything from the Shriners to ex-library association to the Pastors Association to you name it. Everyone, there's a ton of them out there. So when you're shopping for Medicare supplement plans, you have to choose a plan wisely, knowing that once you are in a Medicare supplement plan, you can get in at the age of 65 without any health checks. Once you're in a plan, if you were to change to another supplement, you'd have to health qualify for it the second time around. So it's very important that you pick a plan that is actually going to suit you and meet your needs. Don't be penny wise and pound foolish when you're choosing your Medicare supplement plan. What I mean by that, the lowest price doesn't always mean the best quality. So you just have to factor that in.
Medicare, I'm not there yet, so I don't know.
Absolutely. This is why we're here. The question was, do you get A, B, and D through a private insurer, or is that federal program? And that is the federal program. You actually sign up for that at My Social Security.
So it would be Part C if you sign up for Part A, B, and D through the federal government, right?
That is correct. You sign up either for A, B, and D or C. Yeah. Absolutely. And I also want to point out that if you choose Part C, you still pay the $170.10 for your Part B premium. You pay that premium whether you're doing original Medicare or if you're going to do a Part C plan.
Does that mean you have to do that first before you get any?
The $5,500 is a maximum out of pocket. It is not a deductible. So let's say we said with the Medicare Advantage plans, it's about $300 to stay the night in the hospital, right? Let's say you were hospitalized 5 times in a year, and each of those times you stayed 5 days. So you're at that point approaching the maximum out of pocket. And so after you have paid $5,500 or whatever the individual plan is, that's just an approximate number. The Medicare Advantage plan covers everything 100% after that. That's the most that you would ever pay. The deductibles are what you're paying, the copays and deductibles are what you're paying as you're using the care. And that counts towards your out of pocket. Yes, ma'am. Good question. Yes, sir.
About going back to the drug sign up, where you were suggesting that this change plan, enrollment on a pharmacy plan.
Okay.
So are you saying that pre-existing conditions can come into play if you switch plans down the road?
Oh.
On pharmacy?
Not on pharmacy, no. You sign up for your Part D. I'm sorry, for the folks online, the question was, can you change Part D plans without a health check? And the answer is yes, you can. You will actually most likely be changing Part D every single year because the drug formularies change. And that is why Medicare wants you to do a review with someone every single year to make sure that your drugs will continue to be on the formulary for the next year, especially if you happen to be on a tier 4 or a tier 5 drug. There are 5 tiers of drugs. Your generics are tier 1 and 2, and then the price goes up as we go along. So there are some COPD medications. Some of those specialty medications can be very expensive, and that's really what we really want to double check what formulary works best for you. Absolutely.
Is that big a deal?
It can be, yes. The question was, if you don't sign up for Part D, what is that penalty? So let's say that we're 65 years old, we're going on to original Medicare, we've signed up for A and B, but we did not sign up for D. We're now 66 years old, let's say, and now we need a prescription. If we sign up for Part D, we will be penalized approximately $5 for every year we weren't on the drug plan. But that $5 penalty happens every month. So let's say that we didn't have the coverage. We're 66, we're going to be on a Part D plan and our premium is $30. Your premium is now going to be $35 for the rest of your life. If you were off of it for 2 years or 3 years, that number just, goes up and up. Approximately, yep. Yeah, it really does not make sense to not enroll in a Part D unless you have VA benefits or something else that's creditable coverage.
If you have VA coverage, that you continue above coverage, show that.
That's correct. Yep. You are penalized for not signing up for Part B. And then when you enroll in Part B, that's when they'll assess the penalty. It's a ratio, it's a percentage, and it changes a little bit every year. Part C, yes. You will still be enrolled in Part A and Part B. And when you have a C, it administers the care for your Part A and Part B. But in order to enroll in a Part C, you have to have Part B. Yes, ma'am. The donut hole, the levels of that change from year to year, but it's still in place. So in previous years, the threshold was a little bit lower. That threshold is starting to climb up. Of course, drug prices are also climbing up with it. So good question. Yes, ma'am.
To get a supplement. Are you duplicating pain?
The question was, if you have a supplement, do you also need Part D? And the answer is yes. The supplement does not cover prescription drugs. So you would, if you're going to use a supplement, you would enroll in Part A, Part B, and Part D, and that would cover 80% of your health costs, and then the supplement would cover the other 20%.
If you bought prescription drugs on a plan, supplement plan,
That would be a Part D plan. Yeah, the supplement is for your health care, and then the Part D is for your prescriptions. The penalty would be assessed, a penalty would be assessed if you did not sign up for Part B when you're 65 or turning 65, or Part D. So you can be penalized for both B and D. Absolutely. Any other questions before I move on?
Want to circle back. So, you can get Part A, B, and D through mysocialsecurity.org for Medicare. You don't have to go to these other private companies.
That's correct. When you sign up for Part A and Part D, you're going to create a My Social Security account online,
Right.
and then you would sign up for Part A and B there. And then to get Part D, you would simply go to medicare.gov, and then you would put in your prescriptions, and then they would show you which Part D plan makes the most sense for you where you're at.
Okay.
I would recommend, though, that if you are turning 65, you need to sit down with a licensed professional and have them help you with this process. No, ma'am. You can go to their office in order to sign up, but they don't advise. The Commission on Aging does help out, and I'm really glad that you brought up the Commission on Aging. I'm going to do a little plug here. The Commission on Aging helps a lot of our community, and I'm one of the referrals for the Commission on Aging. And so if you're a client of the Commission on Aging and you have Medicare questions, then they advise you to, I'm not the only one, but I'm one of the folks that they're going to advise you to give a call to. Yes, ma'am.
Right, that for Part C, there's two parts, either a supplemental or an advantage plan. Or did I hear you wrong?
The question was, once again, back to Medicare supplement versus Medicare Advantage. And so you have two options as you're turning 65. Well, not just as you turn 65, when you're on Medicare, you either do the supplement, ABD and supplement, or you do the Medicare Advantage. It's either the supplement or the Advantage plan.
So the advantage is
You, you sign up for A and B, no matter which one you're going to do. All right. If you're going to do a supplement, you sign up for D and the supplement. If you're going to do the Medicare Advantage plan, then that covers your drugs as well. You're not in your head, but I still see some questions in your eyes.
They're one and the same.
That's correct. Part C is a Medicare Advantage plan. This is what you see on television throughout the day nonstop. This is what they're advertising. They're trying to get you into their plan. And they say, you know, let me see your zip code, right? I'm sorry, what was that? And that and Camp Lejeune, you're right. Yes, ma'am.
So a lot of times these private insurance companies have requirements that you use certain doctors, and certain doctors don't participate in certain plans. And I ran into this with a brother in a hospital in Muskegon, and the hospital official said to get out of the Advantage plan because it was hurting him, because they couldn't get doctors to accept the particular plan he was in.
Okay, so yes, kind of on your question. Really, I'm going to paraphrase it for you. Are there networks within Medicare Advantage plans? And the answer is some do, some don't. And so that is yet another area where your licensed professional is going to help you understand. There are HMOs and there are PPOs, and you need to understand the difference between those two, what that means. And you do need to know if your Medicare Advantage plan has in-network or out-of-network coverage. Absolutely. And even within our zip code right here, there are Medicare Advantage plans that do require you to be in a network, and there are plans that don't require. There's one that has a passive network. So as long as the doctor accepts Medicare, the doctor accepts this insurance. And so that one's nice because it travels, right? It's not just in Michigan, it goes wherever you go. On the Medicare Advantage plans? No, they're pretty much $0 at this point. Yeah, whether it's the HMO or the PPO, most of the Medicare Advantage plans are $0 per month. That's a good question. Yes, sir, in the back.
Came in slightly late. Part G, are you going to get into that, or is Part G part of a supplement plan, or?
Okay, good question. For those that are online, the gentleman asked about Part G. And is that part of the A, B, and D? So in Medicare's infinite wisdom, we have Part A, B, C, and D. But then when we label our Medicare supplement or our Medigap plans, we use A, B, D, right? We're using the same letter scheme. And so it's very confusing. When you get a supplement, there are different types of supplements. Plan G is one of the types. Plan D is another. There used to be a Plan F. There's a Plan N. And each of these cover each of these different plans, the Medicare supplement, they cover different areas. Some of them have copays, some of them do not have copays. I know that we said earlier that Medicare supplements don't have copays, but a Plan N does have copays. And the reason they do that is they're able to drop the monthly cost down. You're just sharing some of the cost. So yes, Plan G is one of the Medicare supplement plans. And it's actually a solid one. It's a really good one. The only thing that it doesn't really cover, which none of them do now, is that 233 Part B deductible. And so I'd like to reiterate this just a little bit. On the Medicare supplements, let's say you have a Plan G, you're paying your premium every single month, but when you're visiting the doctor, you don't have a copay and you don't have the deductibles, with the exception of the $233 deductible. So let's say we're going in and we're having our hip replaced. That costs you $233, right? That's it. Your deductible's over. Your hip replacement costs $233. 4 months later, you go in for, I don't know, your thyroid, right? that's not going to cost you anything because you've already covered your $233 deductible. The most you will pay when you are on a Medicare supplement, other than your premiums, is that $233. So if you're going to use a lot of healthcare, you really need to be looking at a Medicare supplement, especially if you have conditions that worsen over time. Diabetes is one that I have a lot of clients that are on Medicare Advantage plans that have diabetes. I'm not saying you have to do a supplement, but what I am saying is that if you know that you're going to need a lot of care down the road, Medicare supplements start to look awfully good. Fantastic. Let's take a look at the Medicare timeline. We are right in Medicare's annual enrollment period right now. We often just call it AEP. It starts October 15th every single year, and it closes December 7th of every single year. And this is the one time you have a chance to make changes to your Medicare plans. Notice that the coverage begins January 1st. So let's say on October 17th, you made a change. You were going to change your Part D, let's say, from one plan to another. Your Part D would actually switch over on January 1st, not when you signed up on October 17th. Then we have a Medicare Advantage open enrollment period. And of course, we can't run that during the same time as the supplement and drug plans. That would be far too pedestrian, right? So its open enrollment is January 1 through March 31st. So let's say you are on a Medicare supplement and you speak with a licensed professional and they recommend that you go onto a Medicare Advantage plan in order to save you some money. And that program begins January 1st, right? You can make changes to that Medicare Advantage plan up through March 31st. So you have that Medicare Advantage, you actually have two windows. You can do it during the AEP, or you can do it during the open enrollment period, January 1 through the 31st of March. You would get a Part D if you're doing a Medicare supplement. If you're doing a Medicare Advantage, the Medicare Advantage plan covers your prescriptions. If you're going to change from a Medicare supplement to a Medicare Advantage plan, you have to do it between October 15th and December 7th. And the reason why is because the drug plan that goes with the Medicare Advantage or the drug plan you're going to be leaving, the only time that you have to do that is October 15th through December 7th time. If you are in a Medicare Advantage plan, you can make a change to that Medicare Advantage plan January 1 through March 31st. It's an additional window just for the Medicare Advantage, but not the prescription. Good question. Yes.
I saw that the Humana Advantage plan was a better option this next coming year. Between January 1st and March 31st would be the time where I can switch from my United Healthcare to.
Yes, the question for our online audience was, if you are enrolled in a Medicare Advantage plan from carrier A and you want to switch to a Medicare Advantage plan with carrier B, you can do that January 1 through March 31, but you can also do that from October 15th through December 7th. That change wouldn't be effective until January 1st. If you do change between January 1 and March 31, if you change carriers for your Medicare Advantage plan, the coverage begins the first of the following month, right? Yes, ma'am.
So if I'm 65 in April, do I need to sign up during this window? Or is when you're the first time, is there?
Man, you guys got good questions. I'm loving this. So when you're turning 65, you have a window, and this is called your initial enrollment, right? This is your, as you're turning 65, you have a window 6 months before, the month of, and then 3 months after in order for you to get everything going. If you're doing a Medicare supplement, 6 months before. If you're doing a Medicare Advantage, 3 months before the month you turn 3 months after. After that, your window closes, and then you have to wait again until the next enrollment period.
I hear you correctly, you said for those starting the initial enrollment, coming up on 65, you have 6 months before your 65th birthday to sign up for a supplement plan?
That's correct. Absolutely. So you can start to make those decisions well ahead of time. And then typically what I do with my clients, we'll start somewhere around the 6 or 5 months before they turn. We'll get signed up for the supplements. When we sign you up, there is a fee, right? You pay your first month's premium, because in Michigan, if you're going to have a contract, there's got to be money exchanged. And so we take the first month's premium when you sign up. Let's just for easy numbers, let's say you're turning in July, right? And we're signing up in January. That premium that we collect would be July's premium. So you wouldn't pay again until August, right? Right. So with a supplement, you can sign up 6 months before. And then at about 3 months out, that's when we would want to enroll you in Part A and Part B. And then about 1 month out, I enroll you in the Part D. Mhm. Yes, ma'am. Mhm. I'm sorry, you said this is your sister? Oh, your daughter's turning 65. And when does she turn 65? In January. Okay, so 3 months before January, she needs to create her My Social Security account, and she needs to sign up for parts A and B. That will begin on the first of the month that she turns 65. Like her coverage begins the first of the month that you turn 65, but she need for A and B, but you need to enroll, I would say a minimum of 3 months before your birthday. You want to be on top of it. That's just the enrollment though, but it becomes active the first of the month you turn 65. She needs to, so that it will be in place by the first. Absolutely. It does not pay to wait on this. Absolutely. So when you're signing up, you get the red, white, and blue Medicare card, right? And it has your Medicare number on it. And also on there, it has your A and B start dates. You actually need that number in order to sign up for a Medicare Advantage plan. You have to prove that you have Part B in order to enroll in a Medicare Advantage plan. So if your window of signing up is 3 months before, you need to make sure you have your A and B start date before you sign up for your Medicare Advantage plan. So being on top of it and getting that done early, so that way everything's in place when you turn 65, that the first day of the month you turn 65, everything needs to be in place by then. She can, as she's turning 65, she can choose a Medicare supplement or she can choose a Medicare Advantage plan. Either way. However, I will say that when you turn 65, this is the only time that you can get a Medicare supplement without a health check. If you decide to go to a Medicare Advantage plan and later you want to go to a Medicare supplement, you have to go through a health check. Many people are denied a supplement based on poor health after they have turned 65. So I often advise my clients, when you're first going on to Medicare, go for the Medicare supplement. This is what you want to start with. If after a year, you've gone to the doctor, you've got everything checked up, right? And you're not paying anything to go to the doctor because you're paying your Medicare supplement, right? So when you go to the doctor, there's no copays. So see all the doctors, man. Get your body checked out and make sure that everything is okay. If after a year, you decide that you would like to go to a Medicare Advantage plan, you can. But when you're turning 65, it almost always makes sense to go with a Medicare supplement first, because you'll never have another opportunity where you don't have to health qualify. you're in trouble then. Yeah. Hmm. That's correct. That's correct. And that's why I was saying earlier, don't be penny wise to be pound foolish. It's really important that you take an honest assessment of your health and what you're going to need in your retirement. And when I sit down with folks, we go over health, we go over income and expenses, and we make a plan that's going to work for you for your entire retirement. And there's a cost analysis that's a part of that. It could very well be one of the major factors of why you would want a Medicare supplement. On that point, on most Medicare Advantage plans, when you start reading into it, you will notice that they call it Part B drugs. That's drugs administered to you by your doctor, not through a prescription, but by a doctor. So rheumatoid arthritis, chemotherapy, the Medicare Advantage plans only cover 80% of that drug cost. And so cancer can be very, very costly if you don't have something in place to cover a critical illness when you're on a Medicare Advantage plan. So just another factor for you to be thinking about as you're making your decision. And so we've actually talked about a lot of different scenarios here. And so what I'm hoping to impart on you is you don't have to talk to me about it, but you need to be talking to someone every year who's licensed and understands the system to make sure that you're making good decisions. In healthcare for the state of Michigan. Yep. Of Arizona. Yeah, I'd actually be happy to talk to your daughter. I'm licensed in Arizona in addition to Michigan. I have clients in New Mexico and Arizona and Washington and Texas. And so I'm licensed in all these different areas, and I'd be very happy to have a 15-minute phone conversation with her. Absolutely. Well, it's such a unique thing. We don't know what we don't know, right? And sometimes we need advice. And when you go to a mechanic, you're not second guessing your mechanic, right? When you go to your financial advisor, you're not second guessing your financial advisor, right? And so retirement planning is very much the same way, and it's okay to accept some help. Absolutely. What time? We're at 11:43. So we have just a few minutes left here. My last slide is who really needs help with Medicare. We've covered this a little bit already. Of course, you need the yearly checkup as recommended by Medicare because of changes to Medicare that happen every year, either a plan change or drug coverage changes. And especially given COVID-19, it's very important that we're staying up with our healthcare. My appointments that I do are either in person or in my office, or I come to your home, or we can do it over the phone or over Zoom, whatever makes you the most comfortable. And then my contact information there on the bottom. Yes. It doesn't cost anything to talk to me. To talk. Yes, sir.
You had said earlier about zip code and requirements therein based upon the zip code.
Yes, for Medicare Advantage plans. So every county has different plans for Medicare Advantage. So what works in Detroit would not work in Grand Rapids, would not work in Grand Traverse County. And so what they do is when you're signing up, you put your zip code in. That way it's showing you the plans that are available to you in your area.
So are you required to take certain coverages by zip code you're suggesting, or are you just saying that different plans are offered?
Different plans. No, the county is not subsidizing the plans. It's just that every county has different plans available. So in Grand Traverse County, we would have different Medicare Advantage plans available to us up here than say someone in Flint would have. Correct. And remember that the Medicare Advantage plans that we're talking about by zip code are private insurers.
I get
Yep, absolutely. Well, let's take WellCare as a company, for example. WellCare is very popular in the southern part of Michigan. You may even know of WellCare through prescription plans. WellCare is moving north, and every year they add counties to their coverage list. This year, in 2023, WellCare is going to be very close to us. They're going to be in Antrim County. They're going to be in Wexford County, but they're not going to be in Grand Traverse County yet. And so if you were in Cadillac, your decision would be a lot different than if you were, in Interlaken. You would only subscribe to a plan that is in your county where you're receiving the majority of your care. WellCare for your prescriptions, right? That's a Part D plan, not a Medicare Advantage plan. Yep, absolutely.
Like, do we pay more up here for, I've always been curious why some people in Detroit can get a lot better, coverages.
Are we talking coverage for a Medicare supplement or for a Medicare Advantage?
You do.
The Medicare Advantage is going to be a $0 premium regardless of what county you're in. You mean the cost at the hospital or?
Yes, I'm talking about Medicare.
Okay, so a Medicare supplement,
Mhm.
those are done by state, not by county.
So Detroit doesn't get a better rate. than-
There
it's
could
all
be
the same.
there could be a company that focuses in the Metro Detroit area that may charge a few bucks less than a plan up here, but that's really the company deciding what premium they need to charge in order to be able to carry a plan in an area. That's really more of a supply and demand thing. Right, but that's a supply and demand thing. So in a metro area, it may be cheaper than in a rural area for a plan based on that. Yes. Yes, sir.
Thanks, Larry. Backing up, you said Social Security will not advise. You gotta walk in there, be prepared to buy the Chevy or the Cadillac, and they make that happen. The advice comes from people like you.
Yes, we provide the advice. We also help people sign up. It's very common for me to be sitting with a client and we just get online and we sign them up for A and B right there. Absolutely. And when you go to the Social Security office, you're only signing up for A and B. You would not get a Medicare Advantage or a Medicare supplement through the Social Security. You would only be signing up for A and B.
And so, where do I find a high deductible plan G available in this area? Do I go to Social Security or do I go to Medicare?
To get a plan G,
Yes.
what I would recommend is talking to me. The plan Gs are done through private insurance. So the federal government administers the care through A, B, and D, but your Medigap that you're going to get will be through a private insurer. That's correct.
Now you're approaching the cost savings of, and that was a broad brush stroke.
It's a very broad stroke right there. Yes. You would just have to know that if you're going to do a high deductible plan G, you're insuring part of you're self-insuring part of that care with that high deductible, right? You're taking on some risk, knowing that if you were to be hospitalized or have a major accident or heart attack or whatever the case may be, I'm not putting that on you, not speaking that out, but you just know going into it that you'd have to meet that high deductible before the Medigap plan would kick in.
Benefit is that, so I turned 65 in February, and so now I can get that supplement plan from the get-go, but I can get the cost down to kind of near the band plan. If I'm willing to take it. So I like the option
Yeah.
of being able to get the
Right. Yeah, absolutely. Yeah, if you would write your name and number here, I'd be happy to give you a call. Thank you. Yes, ma'am. Mm. Whenever you travel, yes, you would get the plan in your resident state. And then as you travel, you want to make sure that you have a plan that travels with you. So if you have a network of doctors that you have to stay within, then you need to make sure as you're traveling, you know which doctors are in that plan where you're traveling, or choose a plan that does not have a network. Your Medicare supplements travel very easily from state to state to state. Your Medicare Advantage, you're going to want to double check if it's in network or out of network. Good question. Yes, sir.
Information I would tell anybody else in the audience that if you happen to be retired before you're 65, you're automatically signed up. I've got my card in the mail already.
Yes, if you are receiving Social Security. Yep. Yes, if you're receiving Social Security before you reach the age of 65, you will receive in the mail your red, white, and blue card, your Medicare card, automatically. They'll automatically sign you up. If you are not receiving your Social Security, then you need to sign up. Absolutely. Disability is the same way. Mhm. Yes, ma'am.
So how far in advance do they send that to you?
3 months.
3 months.
3 months.
Mhm.
So you're signed up for A and B.
Yep.
And you just have to go get your supplement, your D. And then signed up now.
You would get your supplement and D.
They mail you the card.
Mhm.
They're going
Just A and B. So you would need to enroll for D and your supplement.
so
Because D is your prescription drugs.
they need a supplement on top of that.
The supplement is the Medigap, right? That covers the 80%. Medicare covers the 80%. The Medigap covers the 20% that Medicare does not cover.
Medicare. Go get the supplement.
No, ma'am. Medicare, if you're receiving Social Security before you turn 65, you will automatically be enrolled in parts A and B. A is hospital costs, B are doctor's costs. So we're still missing our D at this point, right? Our prescriptions. And then we're still missing our Medigap plan that covers the 20% Medicare doesn't cover. So you would still enroll in part D and a supplement.
One thing you don't have to, or I'm, correct me if I'm wrong, you don't have to enroll in that.
You are not required
But
to,
it's smart to enroll in the
if,
Medicare.
yes, if you're willing to accept 20% of a $100,000
Yeah, I
procedure,
know.
I mean, all the power to you. I
Yeah.
may not be the most fiscally sound decision, but you are not required to get a Medigap plan. Yes, there are a lot of stories of people who wish they had made a different decision. Either they didn't know when they were turning 65 what decisions were in front of them. That tends to be the case, which is why we have these information sessions just like this. Knowledge is super, super important. Yes, ma'am. Hmm? Yeah, that's pretty incredible. Absolutely. It only takes one time for you to really cement that decision in, right? Absolutely. Yes, ma'am, in the back. Yes, ma'am. I'm going to paraphrase your question for our online audience. The question was, if you continue to work past the age of 65, how does that change your enrollment in A and B and D and Medigap? So if you are receiving healthcare, we had talked about this earlier, creditable coverage that you get through your employer, you would defer your Part B because your employer is Medicare Part A would be your primary, the employer would be your secondary. And you're also getting your prescription drugs through your work. So you would not enroll in D. You would defer B and you would defer D but then when you retire, you need to sign up before you retire to make sure that there's not a gap in your coverage. Does that answer your question fully? No, ma'am. As long as you have creditable coverage, when you're going on to that Part B, you could be 68, 69, 70, provided that you've had healthcare coverage. When you go on to Medicare at that point, you would still be able to get a Medicare supplement without a health check if you had creditable coverage. That's a great question. One other thing I should point out, we've been talking about how our Part B premium, that 170.10 for 2022, is automatically taken out of your Social Security check. If you're turning 65 and you're not taking Social Security yet, they bill you for it, but they bill you every quarter. And so a lot of people get surprised that they're 3 months into their Medicare, then they suddenly get a bill for, you know, $400. They're going, what in the world is this? That's because they only bill you every quarter when you're not taking your Social Security. Excellent. Yes, sir.
Just to follow up, I may ask, you know, where can you look at these plans, you know, in case, you know, before I meet with you, like a high deductible Part C plan? Do I find it at Social Security website or healthcare website?
You could just simply Google Medicare supplement plans, and it will show you a chart of what each plan covers. It's typically a matrix, and they've got little check marks and showing you that it covers each area that one plan covers.
It would be like a matrix, you'll have Humana, United Healthcare, all those who order that offer a Part C. And I can compare side by side.
It will be a chart that doesn't even include the carriers. It'll just be, because every Medicare supplement is the same regardless of what carrier you get it from. Right, right. A Blue Cross Blue Shield to a Priority to Shriners, you know, whatever their plan. Every Plan G is exactly the same, no matter who you buy it from. The deductibles would come in a Plan N, or if you choose a high deductible Plan G. But the benefits you receive within a Plan G is going to be the same benefits no matter what company you go with. Same for a Part D. Every company is required by law to cover specifically the same thing for each one of those plans. On that's correct. Yep.
So how do I compare Part D to N across the various insurers?
Across,
The cost of Part G versus Part N?
that's just going to be doing some sleuth work, getting online and figuring that out. You can go to Medicare.gov, but you'll have to go to the individual carrier's website through there in order to start comparing costs of individual plans
Their computer plans on Medicare.gov.
on their Part Ds. Yes. Mhm.
Great advice, Lori. In the beginning, you said just Google what?
Just Google Medicare supplement coverage, and you know, under the pictures, you'll see that graph where it'll show you the check marks in each of the boxes showing you what Plan D covers, what Plan G, what Plan N, so on and so forth. Mhm. Absolutely. Yes, ma'am. Absolutely. Well, both. You know, the VA will give you information related to the VA, but then I would give you information as it relates to healthcare as a whole. You'd want to speak with both. Mhm. Absolutely. These have been great questions. Yes, ma'am. The PACE program is a program where they take on 100% of your healthcare, and so they would administer your Medicare or Medicaid through PACE. That's a good question, and they're a great company up here. They're a private company. Yep. if you're on pace, you want to be sure that you don't enroll in a Medicare Advantage plan because it hurts your PACE coverage. Mhm. So if you know someone who's on PACE and they're watching Joe Namath and Jimmy Walker on TV, tell them, don't sign up for a Medicare Advantage plan. Get everything through PACE. Dynamite. Yes, sir.
Important that, long-term care is not part of any of this.
You bring up,
There's that 100 days, but beyond that, there's nothing to go there.
that's an excellent point, and I'm very glad that you brought that up. It is, well, separate but related. For those that are online, he had mentioned, does long-term care, is it covered by Medicare? And the answer is no, it is not. Skilled nursing is covered under Medicare, but most people, when they're receiving long-term care, is actually custodial care. Someone was holding up that really big, thick Medicare and U book. Who had that? Yes. So I believe it's on page 54 of the Medicare and U book. It might be 52 now, but it has a big section that says what is covered, what is not covered, and long-term care or custodial care is absolutely not covered under Medicare. And that, in fact, is the leading cause for bankruptcy for folks that are above the age of 65. They're just not planning for it. And so make sure that that's part of your Medicare conversations. Custodial care? Custodial care runs, depending on if it's going to be an assisted living facility versus a nursing home, but it can run anywhere from $3,000 to $10,000 a month. A month. So then now you can see why part of your retirement planning, it needs to include a plan for long-term care. Medicare tells us that 72% of the people above the age of 65 will need long-term care in their life. And so it's definitely something that you need to look at. Is my risk covered, right? We know that a house fire, right? Your house burning down, there's a 1 in 1,200 odds of your house burning down. But we insure our house because it's a major asset, right? For you to total your car is a 5 in 1,200 chance, but we insure our car, right? And so 720 out of 1,200 is significant risk. And so make sure that you're talking to someone about your long-term care as you're doing your retirement planning and Medicare. Good question. Thank you for that. Now, well, we let the room down on that one, didn't we? 10,000 a month. When do you start paying? Whenever you need help with your activities of daily life. And so that's being able to feed yourself, incontinence, shower yourself, those types, eating, bathing. Yep. Well, you can get into long-term care plans as early as 50 years old. 50. Yep. And it's something that is recommended by Dave Ramsey and by a lot of folks that make sure that you're taking care of your long-term care, because it can cost an enormous amount very quickly. And that's not including, additional health care that you have. That's just for your residents. So the question was, can you wait till you're older to get long-term care insurance? You can, but just realize that you have to health qualify for long-term care insurance. And the longer you wait, the higher the premiums go, which is true in anywhere in the insurance world, right? If you wait till you're older in order to get life insurance, your premium is going to be higher than when you were 30, right? The same is true with long-term care. Great questions. All right, so it is a little bit after 12. I'm going to stick around. If you guys have some questions, feel free to come up here and speak with me. I do have a piece of paper up here and a pen. I would love for you to be able to leave your number, and I'll reach out to you, and we can chat as well. If there's not any other questions, then we'll call it a session. All right, fantastic. Thank you so much for. I'm sorry, what was that?